Well, thank you very much, Dr. Raju, Dr. Malik, and Dr. Majid. It's rather embarrassing to see your own friends trying to pull your legs by saying good words about you. I don't believe even a half of what they have said, they are just, we are in a mutual appreciation club, I believe, That's how it is. Well, friends, I'll come straight to the topic, and this is how to read a scientific paper. And I'm extremely grateful to my dear friend, Dr. Gautam Saha and Dr. Shah, for giving me the opportunity to be amidst you. And I love being in Kolkata, and this is a great honor to be here, to be before you. Before I start, I would like to acknowledge the great inputs provided to this presentation by my two very young and bright associates, Dr. Triveni and Dr. Swapnajit. Both are working as senior residents in my department, and they are the future of psychiatry in India if they continue to work and live in India. Well, friends, the outline of my presentation, which I'm going to make before you, is as to what's a scientific paper, the anatomy of a scientific paper, how to read a scientific paper, and then towards the end, the most interesting part will be, the first part will be theoretical, and the second part will be an illustration of a real-time paper, and then I will point out to you how it had to be read. Well, if we go further, let's go to what's a scientific paper. If someone asks you about a new movie you haven't seen yet, what do you say? I haven't seen it, but I have heard it is good. And as Chitranjan made it so beautifully illustrative by these Chinese whispers, the information can change as is passed along. Therefore, in order to understand what is there in a particular paper, you have to actually go through it. So what is a scientific paper? Actually, these are the results of the research which scientists report by writing and publishing. This is written in a very formal style. This has been illustrated to you by the first speaker, Dr. Haq Nizami, and then later on so beautifully by Andrade. Then we have the objectives of a scientific paper is to make available the data. You actually review the data which is already available from a set of studies, and then you add your own information to it, so that the objective is a bit altruistic, that the others can learn from them, from what you have reported, and then they can build on it to raise and address new questions. The authors of a scientific paper generally tend to provide an interpretation of what they think that the information which they're providing it means to them. Therefore, it is very important. It's some kind of a personal interpretation of the data which they have generated. And therefore, it is very important for you to look at it very critically, so that you don't get swayed or get biased by their interpretation alone. And other authors, they may interpret, or other readers may interpret their meanings rather differently, and our understanding is always changing. And most good thing about a scientific paper is it always has an inherent heuristic value, in the result that you read about it and you get new ideas, and then you plan your research. Now, it is an essential exercise for all those who are in the business of treating patients and those who are in the business of training people to be competent to treat patients. Therefore, all clinicians, researchers, and students ought to read papers. And if they have to read scientific papers, they have to update themselves with progress in a particular specialty of study. They must find out a solution for a specific problem, which may be diagnostic or therapeutic. They must know about the causation, clinical features, and course of a particular disease entity. And they must understand certain fundamental aspects of diseases like the pathophysiology. And in order to get an idea for carrying out a research work, they need to read scientific papers. At times, it can be that it's a part of a journal club, or your teacher or your guide wants you to go through a particular paper, and he wants you to come prepared with your critical commentary about that particular paper. This is a very good way of actually teaching. And sometimes you quote articles, you quote their results in order to impress others. That also happens. Many people are very fond of it. Now, I think this is a very good quote by John Naisbitt. It says, we are drowning in information, but we are starved of knowledge. We have a tremendous information load which is provided through technologies now, but in order to be more wise, you have to sift this knowledge, you have to chew this knowledge, and then to get the maximum, a nice extract out of this knowledge. Now, scientific literature is rapidly, expanding, and it's so much that it is beyond the capacity of any ordinary human being to actually go through all the scientific papers. You can see how many papers are being published till the last, decade. But here, as of February 8, 2015, PubMed has 24.6 million records. My God. And about 5 lakh new records are added each year. Not only that, 13.1 million of PubMed's records are listed with their abstracts. And 14.2 million articles have links to full texts. Now, who can go through all this, So you have to be very choosy. You have to select your own menu, and then you have to really savor what you have really chosen to go through. Now, please understand, when we look at a scientific paper, it has to be seen whether it is an original research paper, is it a survey, a case report or series, it's a conference proceedings or abstracts, editorial, correspondence, letters to editor. Each has its own relative value, its own advantages as well as its limitations. And there are certain secondary literature like narrative reviews, systematic reviews, meta-analytic studies, book reviews, even the guidelines provided by the professional societies and commentaries. So it is a must to read a scientific manuscript with efficient and methodical approach. This is something which is a must for each one of us who has dared to sit in this hall, Okay, this is something which we have. Now, Clarence Day has said it beautifully. There is an art of reading as well as an art of thinking and an art of writing. The art of writing, Chittaranjan and Rade refer to that. Art of thinking, probably sometime we'll talk about it. But at this time, I will be focusing on the art of reading. Now, this is the anatomy of a scientific paper. It has a title, provides the author's information. It has an abstract, introduction, results, discussion, methods, and references. Okay, you can put it one way or the other. Maybe you can put the methods ahead of results, and this is how the anatomy of a scientific paper goes through. Actually, when you read a paper, you go into the results first. Right. The first thing which catches your eye, what is it tells? What new information it gives me? And then you want to know how that information has been derived by going through the methods. In fact, if you have to read a paper, you must see the title, the authors, there are some people who have a credible, name in a particular field, and they have a continuity of research from that particular investigator or from that center, and that makes it more and more interesting to you. And therefore, you must know which authors are writing that. Then you read the abstract. You may see a little bit of introduction in what context this is being written, because towards the last 2-3 lines of the paper, you will have the context in which this particular paper has been written, and then you will see what are the results, and then in the discussion you can see quickly what have been the limitations of their work, and then come to the how the results have been derived, and then come to the references, whether they have, if at all you are more. Now, this is something you can see in real world, that there is a title, these are the authors, their affiliations, right? Objective, method, results, and conclusions. Okay, now this is all that you need to read in a structured abstract, and then you go ahead making an idea whether you should go through this paper in a very methodical way or not. Now, if you go further, this will give you the introduction. Just look at it, 3 paragraphs, which will tell you what is the relevant evidence in this particular area, what has been the problems or the unanswered questions in this particular area, and which you wish to address. So that is what the introduction will tell you, and thereafter you will go to the aim of the study, the materials and methods section, and then you will come to the results, statistics, results in tables. Okay? Each one has to be read. Many of us actually just read the structured abstract and then forget about it. Much of the information will be really known if you go to the tables. So never omit the tables. Never omit the statistics which have been used in that particular paper. I'll come to those things a little later, and then discussion, which will give you the overall perspective in which that particular paper has been written, and finally the conclusions. Many of us are very good in reading the conclusions and biasing ourselves, So we should not actually go into that temptation, and of course references. Title of a movie attracts a film goer. Is that right? You all agree with me? Same is the importance of the title of a scientific paper. So much thought should go into what is how you frame the title of your scientific paper. It attracts a reader. A good title will inform the potential reader a great deal about the study, and whether to go ahead and read it or just to dismiss it. Most researchers prefer titles which are descriptive and self-explanatory. Title has to be rather descriptive, and the order of authors is very important to know that which of the people have really contributed to the work. In fact, some of the journals are now making it very obligatory that they must tell each author has contributed to in what way in the whole research which has been is being reported. Now this is risk factors for suicide in elderly in comparison to younger age groups. Very short title, and suddenly it tells you, okay, I want to see whether the risk factors of suicide in elderly are any different from those in the younger age group. I'm sure it will arouse anyone's curiosity even sitting in this hall. Am I right or wrong? Because you want to know how the elderly risk factors are different from the younger age groups. And you know about the authors and from where this research is coming. Abstract helps us determine whether we should read the entire article or not. At times it may so happen that abstract itself may tell you, okay, fine, this is what I ought to know. There is no need to now methodically go through the whole text of the paper. Most journals provided free of cost online, and please, most journals now insist that we should write a structured abstract. That means it should have what are the aims, what is the methodology, what is the results, and what are the conclusions which have been reached, so on and so forth. There is always a restriction on number of words which you have to adhere to, and so that you can read it rapidly and decide how to go about further or not. Look at this. This is a structured abstract. Earlier we were having unstructured abstracts. Even they have their own value, please. Nothing is to be dismissed just like that, but it provides you more information than what earlier people used to provide. The purpose of the introduction, and that is the one word which you must remember whenever you are writing an introduction. The purpose of an introduction is to understand the rationale for conducting your study. So therefore, the same principle applies here. When you are reading a scientific paper, the introduction will tell you under what context and rationale this study has been planned and conducted. Usually starts with existing knowledge, concludes with identification of gaps in the literature. It provides a proper background of the study, and readers should also determine whether there has been a study hypothesis or not. And if you know what was the study hypothesis, it will help you to make out whether the results which have been propounded later, they prove or disprove the stated hypothesis. Okay? Now, how to approach the introduction? Grab a blank piece of paper. Whenever you read a paper, a scientific paper, keep a notebook with you and start jotting down. Make notes, draw mini figures, define vocabulary, and answer these questions. What is the accepted state of knowledge? What data led directly to the work of this paper? And what is the hypothesis being tested? Jot it down, quickly. Now, you may go further and see about the materials and methods. It's the technical details of how the experiments were carried out, and all details are rarely included, but enough information is often provided in order to understand how the study has been carried out. It gives you about the information about the number of subjects, the representativeness of the sample on which the study has been conducted, the categorization, the inclusion-exclusion criteria, and the reader should get acquainted with the procedures and equipments which have been used for data collection and make an impression as to whether all this has been done appropriately or not. How to read? Often you can skim over them before the results. Quickly go over it. Then see the results and refer back to the methods. That is the best way to go about when you are reading a scientific paper. However, when you get the results, this is what it is, you need to flip back. Then we come to the research. It provides information in the figures, tables, graphs, even the text form, and here the interpretation of data should not be reported. Those statistical analyses are presented. Go very meticulously through this section and check for reliability and validity. Important task is to check if all the subjects in the beginning of the study were accounted for at the end of the study or not. And believe me, many a times you will find what the authors or the investigators tried to begin with, actually they had dropped off on the way, and that's a bad communication. So please try to see whatever subjects were accounted for in the beginning, whether they have been accounted for or not. Whether any dropout rates, what were the reasons for dropout, how those have been accounted for or not. So that's all has to be done. Identify results that are statistically significant and results which are not. Many of the communications you will read, although the results were not significant, but they are still very important, it has no meaning. Slightly significant, no, that has no meaning. Please, so you must be able to look at it. A correct statistical test has been employed for analysis. This is something which you ought to know. Whether the level of significance is appropriate for the study depending upon the type of question and the study sample which has been used. And you must remember what is statistically significant may not be clinically significant. So don't get swayed by statistics alone, because statistics is a game of often indulged by very clever people to fool others, So you must know whether the statistically what is being projected as significant is really clinically significant also or not. Now, how to read the results? Read the text straight through, examine the figures, take notes, giving yourself a place to refer to about each figure, and with each experiment you should be able to explain the basic procedure, whether it has sought to answer the question it raised, the results, the conclusion, and the criticisms. Now this is the most important section of the article. Research questions are answered here, and meaning of the analysis and interpretation of the data are presented here. So this is something very, very important segment. So usually the study results are compared with other studies. And one of the very poor way of doing this is, in my study, so many were married. Now this was reported in another study that their sample also had married subjects, and in other study there were not so many married people. It makes no sense actually. So this is generally what we do. So that's what we should avoid actually doing it. So look at the similar and dissimilar findings. Ideally, no new data should be presented here, and it should always conclude or end with strengths and the shortcomings of the study. It should provide some suggestions about the further research which can be carried. That means it should have a heuristic value. And finally, the discussions are the author's interpretations and not necessarily the facts. You must keep this in mind whenever you are reading the discussion, that it is largely what the investigators think they have come to, rather than what you think they have really come to. Okay? So you must be able to not get swayed by their interpretations. I think Professor Chitranjan Andrade did make that point very tellingly in his presentation. You don't have to necessarily agree with their interpretations. Barton's study, you can see, which he quoted so beautifully. Now, how to read a discussion? What conclusions do the authors draw? Be sure to separate fact from their opinion and describe for yourself why the data is significant. Does it contribute to knowledge? Does it correct any existing errors? Or it only compounds the errors further? This you should be able to know. Now, references, you must go through the paper cited, and were all the citations correct or not, you must see them, because that shows how methodically the investigators have gone about reviewing the literature. If you find that the references are written poorly, I can give you one thing in complete, I can give you as an affidavit to you. If their references are done poorly, that means the research is done even worse. They have not been methodical in their approach. Please remember it. Now, acknowledgements are there. They are generally, you have to go through this. And lastly, any financial support and sponsorship, particularly for the randomized controlled trials, you must know whether it is industry-sponsored work, so that you know whether there is a conflict of interest or there is no conflict of interest. Well, by now you may be tired of this paper, but don't relax yet. Don't throw up your hands. Save energy for overall reflection and criticism. And now, my friends, I quickly come to the illustrative case to bring at home whatever that I have spoken to you already. This is a paper which appeared in Acta Psychiatrica Scandinavica, not a mean journal anyway. And it's an early view online version. Impact factor of this journal is 5.605, and it will be a pride for anybody to get himself or herself published with a journal like Acta Psychiatrica Scandinavica. Now, this is the study. Association between serum lipids and membrane fatty acids and clinical characteristics in patients with schizophrenia. And you are seeing that this work has actually come from Norway, and there are good centers which are actually associated with this work. Okay? Seen it? Now, in this introduction, they said schizophrenia, the underlying pathological mechanisms are still largely unknown. That is the statement they make in the very beginning to attract your attention, as if they are going to make it known to you during the course of their paper. An important CVD risk factor is the metabolic syndrome, which has an increased prevalence in schizophrenia. Most studies say that patients with schizophrenia have higher levels of serum lipids than in a healthy population, and second generation antipsychotics and lifestyle factors do contribute to all this, Well said, very good. Their hypothesis is levels of membrane polyunsaturated fatty acids, PUFA, are lower, and serum lipids are higher in patients than in healthy controls, patients of schizophrenia. And second, the higher levels of membrane PUFA and higher levels of serum lipids are associated with less severe symptom load. very good, work they are trying to do, something very, isn't so? Something which you and me generally don't think about. So they have done a very good hypothesis they have laid there. And see the emphasis, because anything in red, that means we were very struck by it. So this we have underlined. Okay. To determine the relation, this is the aim of the study, to determine the relationship between lipid metabolism and core clinical characteristics in patients with schizophrenia using both measures of serum and membrane lipids. It's not only serum lipids, membrane lipids also. And secondary analysis to explore the different lipid measures in unmedicated versus medicated patients with schizophrenia in order to see what is the effect of the medications on the serum and membrane lipids and the relationship with the severity of symptoms. Okay? Now this is how you have to jot down and see what you are reading. Now they had 55 patients, 44 schizophrenia, 11 schizoaffective disorders. So I am a bit put off, Why couldn't they keep all the schizophrenia only? Now they have 11 schizoaffective also in it, And they have healthy controls 51. They were assessed on mini. That means they have taken care that they are really healthy. And recruited from hospital employees. Generally not done. Okay, recruited from hospital employees who have been matched for age. Now these are the highlighters that we are looking at, matched for age. That is important. Okay? What would have been more interesting? They should have been matched for gender also. Okay, that is something. Okay, source of patients, an established cohort of patients which have been there in southern Norway in 2001 to 2003. Patients were in a chronic stable phase of the disease and they had excluded subjects with substance use disorders. Now these are your notes while you are reading the paper. And all subjects have given the informed consent. All patients were diagnosed with structured clinical interview for SCID. Therefore, there is no diagnostic bias. There is no personal bias in the diagnosis. And the scales used are given in front of you. And not only PANS, but they have also used the GAF split version, both for the symptoms as well as for the functioning. And they have also done the biochemical assays or lipid profile of subjects. Good. The current and previous use of antipsychotics among 55 patients with schizophrenia were registered. 11 patients did not use any antipsychotic medication at inclusion. This is methodical reading. Okay, you are going about it in a methodical way. The duration of non-use was not measured. Now this, they are not writing. This what we are, after reading this paper, making our notes. The duration of non-use has not been measured. So somebody might have been diagnosed schizophrenia just 1 month ago, somebody might have been diagnosed 10 years ago, and the both have not received the antipsychotics, and it makes quite a lot of difference when you see the results eventually. Okay, now this is how you have to methodically look at the paper. This is the statistics part. I will not make too much of it because they used good statistics. SPSS version 20, mean values of demographic and clinical variables. These were the tests which were used to analyze lipid and clinical data. Correlation exercise was conducted to evaluate the relationship between lipid data and clinical symptoms, and ultimately they did the multivariate linear regression analysis, and that was largely to investigate the effect of patient status, smoking status, and demographic variables, that is sex and age. Now you see the importance of sex. Now, sex and age on lipid measures. So you ought to see what test is being used for what. Okay? This is something which you must develop a habit, and whatever that you don't understand, go to the internet, quickly read about it, or keep some book with you of statistics, go through the relevant section, and after a few months or a year or so, you will quite get at home with it, Okay? Then these will come intuitively to you, Now these are the results. And now see our highlighters. Do you see here? Smokers, 29. Okay? These are the figures. lipid levels in serum and cell membranes in patients and healthy control. And look here, they have taken all patients, unmedicated patients, medicated patients, and these are healthy controls. And they are giving the level of the p-value for level of significance, you know. Now results. No antipsychotic medications were in only 11 subjects. First generation antipsychotics in 5 subjects. And 11 second generation antipsychotics in 39 subjects. The groups are very, very lopsided actually, isn't so? What kind of statistics you can run on this, you know? What kind of inference you can draw on this? Unmedicated patient group versus the healthy control. Significant lower serum levels of HDL cholesterol, non-significant higher levels of triglycerides. Medicated versus unmedicated patients, no significant difference in membrane lipid levels, no significant difference in symptom intensity. Medicated patients had more severe symptoms, however, on GAF-S. And there is no significant difference in functioning on GAF-F. Now this is what you are supposed to write. What are the significant results? Okay. Well, authors are silent about the names of antipsychotics used. Now you have started critically looking at the paper. How can medicated and unmedicated patients differ in GAF but not on PANS? Okay, so either there is some problem with the patients, there is some problem with the instruments, or there was some problem with the selection of instruments to begin with. Because now the interpretation can be ignore PANS and highlight GAF findings, or ignore GAF findings along with the PANS findings. This is how they will write in their discussion. And you will not come to know unless you go to the paper and read it very methodically. Is it okay? My young friends, is that okay? Fine. How can medicated patients can have more severe symptom profile than unmedicated patients? This is a very strange finding that we are finding here. Okay? The medicated patients on medications are actually having a more severe symptom profile despite being on medications than the one which is unmedicated. Regression analysis, and these were the independent variables which they had. And you look at the patients and healthy controls, this table. A similar model was fitted with PUFA and LC-PUFA as dependent variables. The use of antipsychotic medication did not significantly modify the correlation between PUFA and serum lipids and with symptoms measured by PANS. Now this is what we are looking at. Now the main findings of the study in the discussion is there is a positive association between serum triglycerides and HDL cholesterol and severity of positive psychotic symptoms. There is a positive association between red blood cell PUFA and negative symptoms. And they have replicated that higher levels of triglycerides in patients with schizophrenia than in healthy controls. And in the regression model, they found out that the blood lipids were associated with patient status independently of age, sex, fatty acid, supplements, and smoking. Now, these are the main results which they have pointed out in the discussion. And there is a strong association between PUFA and negative symptoms and global function in schizophrenia. Therefore, high PUFA levels being associated with poor functioning and worse negative symptoms. Oh my God, what a loaded statement they are making. And earlier studies had shown a negative correlation between PUFA and negative symptoms. That means higher the PUFA, lesser the negative symptoms. PUFA levels and their correlation to psychotic symptoms may vary from acute to chronic stage of the disease. Now that's a fact which we all ought to know, and which the authors and investigators should have taken into account while discussing their results. Now, the multivariate linear regression analysis says having schizophrenia diagnosis had a stronger influence on serum triglyceride levels than smoking on fatty acid supplement, And these are all independent of lifestyle, and they have also quoted a study where the Anderson had said the polygenic overlap between blood lipid levels and schizophrenia genes was found. But what are the limitations? This is a cross-sectional design, not fit for conclusions about the causality. The authors in the discussion are talking about causality and causality and causality in a very affirmative manner, a very assertive manner, where a cross-sectional design of the study is not fit for talking about causality. They should have only talked of associations and been rather modest. That would have been better. Second, positive and negative symptoms of schizophrenia fluctuate over time. We all know it. Hence, at the time of the study, we don't know what kind of fluctuation was happening in these, and whether this could be, it could influence the associations which they have found. Weight of subjects was not obtained. Weight is a very important parameter. It's a confounding variable which was absolutely ignored. Okay? And no information about past use of antipsychotic medication. And they were not assessed the duration of being unmedicated, as I pointed to you earlier. Conclusions: the associations with symptom-severity lipid levels among limitations schizophrenia suggest an important role of lipid biology in schizophrenia, and the clinical implications are lipid profile can be used for individualizing the treatment regime for each patient. See what they are suggesting. Something very, very... Now this is a critical analysis of the paper. A new study which tried to establish that metabolic syndrome or lipid abnormalities can be a part of illness itself and not of antipsychotic use alone. Well, very good till then. Methodology is simple. Pitfalls: small sample of total patients. Very small sample, actually. Very small sample of unmedicated patients. Several confounding factors not controlled. And healthy controls are not exactly healthy, because they have, many of them were smokers actually. And that can influence the results. Change in serum lipid levels. Now these pitfalls are not the authors. This is what our now comments are. Change in serum lipid levels can be a non-specific finding in patients with schizophrenia. No other comparison group with mental illness with serum lipid level, serum lipids data was taken in the study. Whether such changes in serum lipids occur only in schizophrenia and not in other mental illnesses, we don't know. And the mean values of serum HDL and serum triglycerides of patients are in normal limits. They are seeing the differences, but ignoring that they are all within the normal range. So the subjects are not even in the state of dyslipidemia. So how can we come to this conclusion of a paper published in Acta Psychiatrica Scandinavica? Now this is something you have to develop a habit, my dear friends, to critically analyze a paper, to look at the paper in its complete anatomy, and then to draw your conclusions so that you do not get swayed, biased by the interpretation of the authors. Therefore, before thanking you, please, if you make the paper too easy to read, everyone will know how you got the results. Okay, thank you very much.